Yeah, I want to ask you just a little side. You were mentioning how the Sinclair Method is a 30-year-old model. Do you personally or professionally, can you share a little bit why it's taken so long to kind of reach mainstream or be accepted? Is that just how medicine works? It's just a slow process? Or?
Yeah, it's partly how medicine works. I think partly you get a coalition of so one thing that so most medical problems yield to either you have an evolving catastrophic problem like HIV. At one point, HIV was one of the leading causes of death in the United States and was consuming 2% of all healthcare spending.
Wow.
Right, and all for hospital care, for end of life care for people, and it was unclear just how far, whether once if HIV had transited to the fully to the heterosexual young community, where I think you would see today, like Africa, you would see huge quantities of HIV disease and death. And if hadn't been therapy developed, you could have lost 10% of humanity or 20% of humanity over time. And it's amazing, like how devastating that could have been. So when faced with, like truly catastrophic medical diseases, like people can pull it together and get going. And even in stigmatized diseases like sexually transmitted diseases, and in populations that are historically oppressed, like gay people. So you can get traction to make changes. I think alcohol has been one of those things that's just sort of an accepted baseline of humanity, and like it's just accepted that people get drunk and become alcoholics and lose their jobs and their relationships, and it's kind of amazing. It's because it's not new, like why should we care? And but I think that's changing a little bit and it's changing because there's less tolerance for the kind of social behaviors like domestic violence, public intoxication, driving under the influence. There's less tolerance for criminal behavior. I think people are unaware that 40% of people in a prison committed their crime while intoxicated on alcohol.
What? 40%?
40% were drunk at the time they committed their crime.
Oh my gosh.
So you if you're really going to talk about getting our prisons unloaded, you're going to have to talk about alcohol at some point. You have to.
Wow.
And until you talk about that, you're not going to be talking seriously. So I think so I think there's we're at the nexus point where people are caring. Mm-hmm. And when you get people caring about something and wanting to make a difference and realizing that there is a problem that can be addressed, then you can make a lot of progress.
Yeah.
And as I said, I think there's an increasing cadre of doctors who are willing to prescribe medications for alcohol abuse. As I said, I think their challenge is going to be monitoring systems, mm-hmm. and to knowing how they're doing, and having a way to follow. Well, and I hope that we're, our plan is to certainly be the leader in that, and to bring that, to be the people who make that actually happen on a large scale.